Good afternoon, fellows and friends. It is my distinct privilege to be here with you this weekend, and in this moment to stand before you to welcome and introduce our next keynote speaker, Dr. Brian Lawlor. Brian is a geriatric psychiatrist with more than 30 years' experience in managing Alzheimer's disease and late-life mental disorders. He has established community and hospital-based geriatric psychiatry services in inner-city Dublin, Ireland, and directs the Memory Clinic at the St. James Hospital, a major teaching hospital of Trinity College, Dublin. He is also the Deputy Director of our own Atlantic Fellows for Equity in Brain Health, or GBHI, at Trinity College, Dublin. Brian's research interests span early detection, diagnosis, and treatment of Alzheimer's disease, dementia, and mental disorders in the elderly. We welcome him this afternoon to share thoughts on dementia, changing the narrative from tragedy to hope. Dr. Brian Lawlor.
Good afternoon, everybody. It's a great pleasure and a great honor, actually, to be here this afternoon. Thanks to Evie and to Penelope for this wonderful invitation. But with every opportunity comes a sense of threat, as you know. So, as I was flying over here this morning and thinking of the theme of connection and community, I began to think about how am I connected to you, to this community? How can I bridge my work to your work and really enter your world? In thinking about this on the plane, I thought, well, first and foremost, we have to really understand and share how and why we've arrived here. And I don't mean physically, by plane or by taxi. We haven't arrived here by accident. We have to really understand the stories of who we are and where we've come from to appreciate why we are here and what purpose we're going to serve. And I know that you've already begun to tell your own stories, to share your own stories with one another, to try and help understand who you are and why you are here. I think as a psychiatrist, you always feel that you make sense of the present by looking back. It's hard to make sense of the present when you're in the present, but you make sense of it by looking back. So first of all, let me tell you a little personal story that I think connects me to now, that I thought about on the plane, and indeed to this community. I want you to listen now again. So, as Kai said, I'm a psychiatrist. I hope that doesn't worry you. What does a psychiatrist do? Does psychiatry work? These are questions that I've often had myself during my training. I trained initially in Ireland in internal medicine and then went out to the United States and trained in psychiatry. And in 1986, I went to the National Institute of Mental Health in Bethesda, in Maryland. And for me, this was the center of the universe for biological psychiatry. At that time, there was great hope that biological psychiatry was going to create a revolution in the whole area of mental health. I went to work in the area of Alzheimer's disease with the hope and the aspiration that we were going to make a huge difference in that area. So when I arrived about 2 weeks into my fellowship, my mentor called me aside and he said, Brian, I want you to meet with Dr. S. Who's Dr. S? Dr. S was a training analyst, psychoanalyst from the Washington Psychoanalytic Institute. Now, I was here to do biological psychiatry. I said, well, why do I need to see a training analyst? I mean, I don't need to be analyzed. So I fought this and resisted it for a week or two, but eventually I met with Dr. S. His first name is Earl. They refer to him as Earl the Pearl. And I reluctantly met with him, but over the course of weeks and meeting with him on a weekly basis, it became an incredibly wonderful experience for me in terms of helping me understand myself, understand my situation, my place, where I'd come from. By the end of the year, we had become very good friends, and I really valued meeting him. I was going to miss him. And when it came to the Ask session, I asked him, as a man with great experience, how does psychiatry or how does psychotherapy work? And I'll always remember what he said to me. He said, I don't know. Pause. He said, but I think. I think it's for the first time in a person's life that they have been listened to in a non-judgmental way by someone else. And that experience has helped them see their life in a different light, and given them hope for the future. Because hope is about the future. So I think this is one connection for all of us across all of our communities here today. The importance of listening to one another. Listen now again. Helping one another make sense of where we are and why we are here, and building towards a better future. Another connection here with Seamus Heaney, one of the greatest Irish poets since Yeats. He was professor of poetry here in Magdalen College at Oxford between 1989 and 1984, before he got the Nobel Prize. Is this connection is the art of listening. And again, he said, Heaney himself, a great poet, storyteller, was a great listener. And I had an opportunity a couple of weeks ago to visit this incredible exhibition of his life and work in Dublin. And, poets like Heaney, through their ability to listen and listen carefully and pay attention, allow us to see things differently and imagine how things might be. He also spoke and wrote about hope, which I'm going to talk a little bit about more in terms of dementia. And he described hope as a conviction that there is something good worth working for. This conviction about hope and doing good work, again, is another connection, I believe, for all of us across all of our communities, doing good work. Because this is hope. So this brings me to my talk about hope and dementia. And I hope there will be many, many points of intersection and connection that will arise from this talk. And I've asked my panelists to go lightly on me in their questioning. So I'm going to talk a little bit about the current narrative around dementia, which is one of generally of tragedy, sense that nothing can be done. Talk about what hope is, why it matters. Some stories from Ireland about how we are trying to change the narrative. I'd like to talk about you, actually. Good leaders, good leadership, and changing culture, and the importance of hope and how it links to the Atlantic Fellows. And I hope to come back to Heaney on that. So the tragedy narrative. This is a very powerful and positive statement from the Lancet Commission. It says that acting now on dementia prevention, intervention and care can vastly improve living and dying for individuals with dementia and transform our society. A powerful, positive and hopeful statement from 2017. But what's stopping us acting now? If this is a statement from the Lancet Commission. Well, first of all, we have a knowledge gap. However, we know a lot about dementia. We know a lot about what works, what doesn't work. So it's not so much a knowledge gap as an implementation gap, a failure to implement the knowledge that we know. There is an awareness gap. There's an awareness gap among healthcare professionals, like myself, but also among the general public. That's a gap that needs to be filled. Very importantly, there is a leadership gap. It's not just the numbers of leaders. It's the types of leaders that we need. Leaders from different professions. Leaders who can talk to one another, who can listen to one another, who can change the culture. Perhaps one of the biggest issues stopping us acting now around dementia is stigma, fear, and implicit bias. This doesn't just apply to dementia, of course. And again, this is one of our intersections where our communities collide. Fear and stigma are the great enemies of hope. And dementia is one of the most feared conditions in people over the age of 50 in the developed world. Now, this may not be the case in the developing world, but in the developed world, it is one of the most feared conditions. So there's great fear out there. If you look at what the attitudes of healthcare professionals are to dementia, they abound in a sense of hopelessness. What's the point? There isn't a whole lot we can do. They feel there aren't a whole lot of treatment options for people with dementia. What's the point of making a diagnosis? And as doctors and healthcare professionals, we often focus on risk and disablement and safety rather than enablement. So oftentimes, we stop people with dementia from participating and being included, the very thing that would benefit them most. So this is what I think is going on here. With regard to dementia, the tragedy narrative, the sense of nihilism, we have a lot of unconscious negative thoughts, ideas about dementia. This blocks our empathy, our ability to actually put ourselves in the shoes of the person with dementia. This creates a lot of negative, aversive type reactions and behaviors in us, and we get this sense of othering. Othering is familiar to you? We're connecting, aren't we? Them and us. We don't see people with dementia as part of us. It's them and us. Now, the power of hope and the therapeutic power of hope is amazing. And as a clinician over the last 30, 35 years, seeing people with dementia, I've always been impressed by how important it is to make sure that the person with dementia, when you make a diagnosis, disclose a diagnosis, it's difficult, it's not easy. But when they leave that office, when they leave your room, it's important that they leave with some level of hope for the future. That's crucial. And many times patients or family members have come back to me and said how important it was. One word that you said, one thing that you did, one pathway that you directed them towards was so important in terms of quality of life. So hope is hugely important. We know that in cancer. We know it's hugely important also in dementia. Now, what is hope? It's an emotion and a way of thinking. The emotional part of hope, thinking of a better future, is unconscious. It's linked to a sense of trust, care, and caring. But the thinking part of hope is about having the will and the way, having the motivation, the agency, and the goals, but also you need pathways. So for the person with dementia, when disclosing the diagnosis, if you're a healthcare professional, a doctor, it's very important to be able to do that in an empathic way, a generous sense of trust and caring. But it's also important that you instill in that person the motivation and goals that they can achieve something and feel better, but also point out the pathways. A lot of these pathways are around inclusion, engagement, involvement. And this is very, very important. Hope is really crucial in the face of uncertainty, and there's nothing more uncertain than a diagnosis of dementia. Diagnosis of cancer leads to uncertainty as well, but there are more specific treatments. But hope is crucial when there is such uncertainty. Looking at the model again, hope can boost empathy, and knowledge and awareness can raise hope. And I think this is the way forward. We need to raise knowledge and awareness around dementia, boost the level of hope. This will change the empathic response at an individual and a collective level, change the reactions and behaviors, and stop the othering process. So it'll be more an inclusion of the person in society. Now, what am I talking about when I'm talking about evidence-based messages of hope? But there are lots of evidence-based measures of hope. Not all dementias are the same. They don't all progress at the same rate. There are modifiable aspects to most forms of dementia. For example, if people have depression or anxiety, that can be addressed. If there is hypertension, hypercholesterolemia, diabetes, these can be addressed. If you address medical issues in people with dementia and prevent delirium, you can decrease the risk of progression and deterioration. Even in Alzheimer's disease, there are variable trajectories. Patients are fearful that they will have a very rapid course, like Mr. Smith down the road. Projections, the trajectory for people, the rate of progression can be very variable. Another thing I've learned down through the years is that we very much underestimate the quality of life of people with dementia. Clinicians, but also family members. And there are many interventions that really do work for people with dementia and for their family members. Just give you some examples here. Evidence-based interventions, cognitive stimulation for mild to moderate dementia, rehabilitation, cognitive rehabilitation for mild cognitive impairment and early stage Alzheimer's disease, and most particularly strategies for relatives. There are many different types of interventions for relatives that really make a huge difference in terms of quality of life of that individual, the caregiver. And their quality of life and their mental health can certainly impact on the outcome and the trajectory for the person with dementia. For those of us at the age of risk, which is right now and even before midlife, there are really important messages of hope. Up to a third of cases of Alzheimer's disease and dementia can be potentially prevented. If we treat hypertension and atrial fibrillation, we can prevent stroke, and stroke is a common cause of dementia. If we treat midlife hypertension, there's a good likelihood that we may be able to decrease the incidence or a number of new cases with dementia and Alzheimer's disease. Addressing vascular risks, exercise, diet, cognitive training, all of these interventions can decrease cognitive decline. So addressing modifiable risk factors in those at risk, certainly at midlife and perhaps earlier, is a very important message of hope. So the tragedy narrative around dementia is really fake news. So if we want to change the narrative, this is what we have to do. We have to increase knowledge and awareness of the evidence of what we can do. This will raise hope, grow empathy, and it will change at an individual and collective level negative reactions and behaviors so that people with dementia can be included. I wanted to give you some stories from Ireland, some of the work that we've been doing that illustrates the points I'm making around boosting knowledge and awareness, raising hope, and changing the narrative. One project that I've been involved in, which is funded through Atlantic Philanthropies, was looking at developing an integrated care pathway at St. James's Hospital that Kai mentioned. We changed some of the environments, we created this integrated care pathway, but most importantly, we provided bespoke training and education for everybody in the hospital. Now, this wasn't just healthcare professionals, this was security, catering, everybody. And everybody who came to the hospital and was looking for a job and was employed, they had to go through an induction course on dementia. They had to learn about dementia. And we did an assessment of the level of self-rated knowledge and attitudes to dementia before and after the training intervention over the course of, say, 2 years. And really what we found was that we were able to improve the level of self-rated knowledge, but most importantly, we changed the attitudes towards dementia. And the better the level of knowledge, the stronger the hope, the stronger the sense that you can actually do something, help the person with dementia. It's very, very powerful. Knowledge tightly connected to hope. Here are some of the comments from staff members who did the training. And I think you'll note that they use words like empathy, understanding, confidence about helping the person, being more aware of what they could do, understanding the needs. And sometimes this qualitative information is much better than the quantitative data that you can generate. The other story of hope around dementia I want to share with you is about our national awareness campaign called Understand Together, www.understandtogether.ie, where we're trying to change awareness in the general public. This awareness campaign was funded by the Irish government, but also part funded by Atlantic Philanthropies, who are involved in the dementia strategy in Ireland. In this campaign, we had a planning phase where we did surveys and stakeholder interviews. Then there was an implementation phase over a period of 2 years with a targeted media campaign, repeat surveys, and then a sustainability phase. And then right now we're doing this phase of community activation. which I think is perhaps most relevant to the communities here. So what do people say when we did surveys or talked to them in focus groups about the level of awareness and knowledge? This is the general public. They thought that society excluded people with dementia. 4 out of 5 people would be scared or anxious about getting a diagnosis of dementia. 1 in 3 wouldn't want their friends to know. 1 in 4 would delay getting help. And again, they emphasized the level of loneliness, isolation, and stigma, and how the condition changed relationships within the family, outside the family, and their whole lifestyle. Only about 1 in 4 thought they had a good handle on what dementia was, a good knowledge of what dementia was. But half the men surveyed felt they knew very little about dementia. I think this finding here is striking, because this was about the messages of hope I talked about before, what you might be able to do to prevent dementia. And again, very poor awareness that there was things that you could potentially do to prevent dementia, that there was something they could do. For example, looking at specific knowledge about particular risk factors or protective factors, very little knowledge that obesity was a risk, high blood pressure was a risk, smoking was a risk, alcohol, type 2 diabetes. Again, very, very poor knowledge about this, which was striking. So what we did, based on the information that we had, we created messages and stories of understanding, support, and hope, about standing together, about participation, trying to break down the barriers. Also, importantly, we said there are things you can do. There are things that you can do to protect your brain and improve your brain health. So essentially, it was a call out to the public and really to activate these pathways of hope. We created the website, but most importantly, we tried to change the narrative around what dementia was. So we tried to provide the reality of a much more positive view of what dementia was. So these are images of people with dementia involved in the choir, involved with cultural activities like art galleries, involved in exercise, social groups, and with their families, because this is a reality. We also focus very much on storytelling, telling true stories, positive stories about dementia, because storytelling really is how you can change culture, isn't it? And here are some of the images of some of the stories of families told about their experience of living with dementia, positive stories. So we had surveys at the beginning, and then at the end of the media and campaign, we looked to see, well, was there a change in attitude? Are we making a difference? Are we changing the narrative? So what we're finding now from the surveys is that there does appear to be a change in attitude, a sense that people with dementia, the idea that people with dementia are able to participate, that's more people in Ireland believe that is the case. Also, people are not quite as negative in the sense of feeling that they wouldn't want family members to know, or that they would feel embarrassed or ashamed they'd had a diagnosis. So we believe that slowly we are changing the attitudes and this is because we are raising awareness, increasing knowledge and understanding of what dementia is. And people are beginning to take action. They're beginning to interact more with people with dementia, trying to include them in activities. Again, this is just based on the survey activity. We're moving now to community activation, trying to focus on developing champions and stakeholder contacts within each and every local community for people to take action locally to engage and involve people with dementia. We're trying to create a society where people are respected, included, and connected to their community. Specifically, we're asking people in their local communities to take action. And these are the 6 actions that we're asking people to take. See the person, not the dementia, talk to the person, stay in touch, ask how you can help, support the person, and try to modify the service space if you're a company, a bank, a library. And this process is in train at the moment. It's pretty active. We've enlisted community champions. We've got about 40, 50 national stakeholders like insurance companies, banks, libraries. And also we're engaging on an individual basis. And we think that this grassroots or type social movement of community activation can make a difference. That we may be able to change the culture around dementia. Essentially, we're trying to create this human chain of understanding, connecting, including, and making sure that people with dementia are valued. Now I just want to move on to this issue of leadership and then end up talking a little bit about Atlantic Fellows and hope. I mean, hope doesn't happen on its own. You have to work at it. And hope needs a plan, it needs a pathway, and it needs leadership. Now, everybody wants change, and we heard about that today. We all want change. Sometimes it's hard to change yourself. And getting leaders for change, there can be no one in the room. That's not going to happen here, I know that. So if we're really going to change the narrative, I think we have to have a different type of leadership. I talked about it's not a numbers game. It's breaking down the silos. It's people who can listen, who are self-aware, who can connect. Listen now again. I think listening is crucial. By listening, you can see things. Not just how they are, but maybe you can imagine how they might be and how you might change things. Leadership, though, is not just about you and me. We need a coalition of leaders. We need a partnership. This is the case for dementia. I'm sure it's true for the work that you are doing and tasked to do. We have to, it's not just listening. You can listen and not hear. You have to listen and hear the voice of the person with dementia. We have to engage with leadership in terms of caregivers, healthcare professionals, advocacy, and government and policymakers. We can't do it on our own. You can't do it on your own. It's about networking and connecting, but most importantly about listening now again. So I haven't got my 5-minute warning yet, so I'm way on time. A narrative of hope, not a narrative of tragedy. Tragedy, it is fake news. I've told you about the evidence-based stories of hope around prevention, interventions, and care. They're real. Unfortunately, people aren't aware at the general public level, healthcare professional level. We need to make that news. We need to promote stories of hope around the lived experience, because the lived experience can be a good experience for a long period of time. I think most importantly, we need leaders, good people, good leaders to change the culture, who can listen and talk and work together. But you can't do it alone. You need a coalition, an activated and connected community, if we're really going to create these fairer, healthier, more inclusive societies for people with dementia. Now, I'm just going to leave you just with this poem. Maybe you can't read it from the back. This is Cura Troy from Seamus Heaney, and this is another connection. And I think it's a connection about hope, but it's also a connection back to the previous topic. It's really about how, we can transform betrayal into reparation and success. And so oftentimes when I know many people have used this poem, and particularly the part where it says, history says don't hope on this side of the grave, but then once in a lifetime the longed for tidal wave of justice can rise up, and hope and history rhyme. Heaney, when he wrote this, was thinking of Mandela and Mandela's release. He was also thinking about the troubles in Northern Ireland. But this is the universality of a storyteller. He can connect locally and globally to lots of issues. But deep within that poem of betrayal and mistrust is hope. And I think it's a very, very powerful message. but also this tidal wave of justice rising up. My sense is that this is you. This is the Atlantic Fellows. And there's a real good chance, I think, that hope and history can rhyme as we go forward, not just in the case for people with dementia, but for justice worldwide. I'll finish on that. Thank you very much.